Hello everyone. Today, we're diving into the world of a medication called Valbenazine, commonly known by its brand name, Ingrezza. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Valbenazine, recognized by its brand name Ingrezza, is an oral medication specifically used to treat tardive dyskinesia, TD, in adults. Tardive dyskinesia is a condition characterized by involuntary, repetitive body movements, often resulting from long-term use of antipsychotic medications. Valbenazine belongs to a class of drugs known as vesicular monoamine transporter 2, VMAT2, inhibitors. By inhibiting VMAT2, it helps regulate the levels of dopamine in the brain, thereby reducing the abnormal movements associated with TD. The FDA approved Ingrezza in 2017, marking it as the first medication specifically approved for the treatment of tardive dyskinesia. Warnings: Valbenazine comes with specific precautions. It is important to discuss your medical history with your healthcare provider before starting this medication. Ingrezza is not intended for use in individuals with Huntington's disease, as it can exacerbate the symptoms. Patients with a history of heart conditions, including arrhythmias or other cardiac problems, should exercise caution as Valbenazine may cause QT prolongation, a condition that affects the heart's electrical activity and can lead to serious irregular heartbeats. Before taking this medicine. Before starting Valbenazine, several factors need consideration. Inform your healthcare provider if you have any allergies to the drug or its ingredients. If you have liver problems, heart conditions, or are pregnant or planning to become pregnant, it's crucial to discuss these conditions with your doctor. Valbenazine can pass into breast milk, so it's important to talk to your healthcare provider if you are breastfeeding. It's also vital to inform your doctor if you have a history of depression, suicidal thoughts, or behavior, as Valbenazine may increase these risks. You should not take Valbenazine if you have congenital long QT syndrome or if you are currently taking medications known to prolong the QT interval, such as certain antipsychotics or antibiotics. If you have a history of cardiac arrhythmias or any other heart condition, discuss this with your healthcare provider, as Valbenazine can increase the risk of heart-related side effects. Side effects: like all medications, Valbenazine can cause side effects. Common side effects include drowsiness, dizziness, fatigue, and dry mouth. Some individuals may experience a significant increase in blood sugar levels, so regular monitoring is advised, especially for those with diabetes. There is also a risk of depression and suicidal thoughts. If you experience any mood changes, it's essential to contact your healthcare provider immediately. Additionally, serious side effects may occur, including QT prolongation. Symptoms of QT prolongation include fast or irregular heartbeats, dizziness, and fainting. If you experience any of these symptoms, seek medical attention immediately. Other potential side effects include sleep disturbances, urinary retention, and increased prolactin levels, which can cause menstrual changes or sexual dysfunction. Interactions: Valbenazine may interact with other medications. It's crucial to inform your doctor about all medications, supplements, and herbal products you are currently taking to avoid any adverse interactions. Medications such as monoamine oxidase inhibitors, MAOIs, certain antidepressants, antipsychotics, and drugs that affect liver enzymes can interact with Valbenazine and alter its effectiveness or increase the risk of side effects. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Valbenazine. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended starting dose of Valbenazine is 40 mg once daily, which may be increased to 80 mg once daily after 1 week based on individual response and tolerance. It's important to take Valbenazine exactly as prescribed by your healthcare provider and not to alter the dosage without consulting them. Avoid: while on Valbenazine, it's advisable to avoid alcohol as it can exacerbate certain side effects such as dizziness and drowsiness. Given the potential for drowsiness, it's wise to avoid operating heavy machinery or driving until you know how the medication affects you. It's also important to stay hydrated and avoid overheating, as Valbenazine can cause reduced sweating, leading to heat stroke in some cases. FAQ: many wonder about the age restrictions for Valbenazine. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of valbenazine, commonly known as Ingrezza. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.